Hello, everyone. I'm Aubrey Denise Polvera, and today I'll be discussing pneumonia, which is one of the most common and serious respiratory infections we see in medical surgical nursing. So, in the short lecture, we'll cover its definition, causes, pathophysiology, types, diagnostic tests, and its medical and nursing management. Because by understanding how pneumonia affects the lungs, we can recognize symptoms early and provide proper nursing care. So, let's start with the definition. Pneumonia is a lower respiratory tract infection, meaning it affects the lungs, not the upper airways like the throat or bronchi. So it causes inflammation of the alveoli or air sacs in one or both lungs. When these air sacs become swollen and filled with fluid or pus, oxygen can't pass into the blood properly. And that is why patients often experience shortness of breath, cough, and fatigue. Their bodies aren't getting enough oxygen. So, for the pathophysiology, it begins when bacteria, viruses, or fungi enter the lungs through inhalation of droplets, aspiration of secretions, and contact with fomites, or even through the bloodstream. So, once inside, the organism invades the alveoli and triggers inflammation. White blood cells then rush to the site of infection, fighting it off, which makes the capillaries around the alveoli more permeable or leaky. This allows fluid, white blood cells, and fibrin to leak into the air sacs, forming thick exudate. Over time, the alveoli fill with pus, which is a process called consolidation, which blocks gas exchange. And as a result, oxygen levels drop, leading to hypoxemia and dyspnea, or difficulty breathing. So, under etiology, pneumonia can be bacterial, viral, or fungal. So, for bacterial, we have Streptococcus pneumoniae, Haemophilus influenzae, Staphylococcus aureus, and Klebsiella pneumoniae. So, these cause sudden severe infections with fever and productive cough. For viral, we have the influenza virus and respiratory syncytial virus, which are milder but highly contagious, often following colds or flu. For fungal, we have Pneumocystis jirovecii, Candida albicans, and Aspergillus, which are usually seen in patients with weak immune systems, such as those with HIV or undergoing chemotherapy. For the risk factors, pneumonia is more likely to occur in the very young and elderly due to their weaker immunity. People with HIV, cancer, or on immunosuppressants are also at risk. And then those with chronic illnesses like COPD or diabetes have reduced lung infection and slower healing, which makes them more susceptible to the infection. Malnutrition, smoking, and alcohol use weaken the body's natural defenses, which also make those patients more susceptible to pneumonia. And then bedridden patients are prone because secretions pool in their lungs. And finally, those with aspiration risk, such as patients who have trouble swallowing or are unconscious, can inhale food or fluid into their lungs, which leads to the infection. So, pneumonia can be classified into three types: lobar, bronchopneumonia, and interstitial or atypical pneumonia. For lobar pneumonia, this affects one or more lobes of the lung and starts suddenly, often due to the Streptococcus pneumoniae. So, symptoms include high fever, pleuritic chest pain, and rusty sputum. Because one lobe is consolidated, breath sounds are reduced over that area. In comparison, we have bronchopneumonia, which has a patchy distribution throughout both lungs. So it develops gradually and is caused by the Haemophilus influenzae or Staphylococcus aureus. And common signs include productive cough with yellow-green sputum, mild fever, and dyspnea. For interstitial or atypical pneumonia, this affects the tissue around the alveoli. But why is it called atypical pneumonia? Well, this is because it is caused by uncommon microorganisms such as the Mycoplasma pneumoniae, Chlamydia pneumoniae, or viruses. So symptoms are milder. often including a dry cough, headache, and low grade fever. And lung sounds may even be normal due to a decrease in the secretions as compared to the first two types. So, for visual comparison, here's how they look like on x ray. In lobar pneumonia, notice how one section of the lung is dense and is white. That is a lobe filled with pus. In the middle, we have bronchopneumonia, where there are scattered white patches across the lungs. And on the right, we have interstitial pneumonia, where the lungs appear hazy because inflammation affects the tissue and not the air sacs. So for diagnostic tests, we have chest x-ray, which confirms pneumonia and shows white or cloudy areas of infection, as seen in the previous slide. Sputum culture and sensitivity identifies the microorganism and tests which antibiotics it's sensitive or resistant to. This varies per patient, so the results help choose the most effective drug. Your complete blood count shows elevated white blood cells. What again is the normal range of white blood cells? Okay, so it's 4,500 to 11,000 cells per microliter of blood. So if it's higher than 11,000, that means your body is fighting off an infection. Last, we have pulse oximetry or arterial blood gas analysis, which checks for oxygen levels in the blood. So, if there is a drop in oxygen or hypoxemia, this means that gas exchange is impaired by inflammation and fluid buildup. For medical management, treatment depends on the cause. So we have antibiotics if it's bacterial, antivirals if it's caused by a virus, and antifungals if it's caused by fungi. So oxygen therapy supports breathing and corrects low oxygen levels. So what again is the difference between hypoxemia and hypoxia? Okay, so hypoxemia is low oxygen in the blood, while hypoxia means low oxygen in tissues. Hydration and rest thin secretions and support recovery, while antipyretics like paracetamol or ibuprofen relieve fever and discomfort. Our expectorants, such as guaifenesin or ambroxol, loosen thick mucus for easier expectoration. So, for nursing responsibilities, we should monitor vital signs and oxygen saturation to catch early signs of hypoxia. Position the patient in semi-fowlers to ease breathing and promote lung expansion, and also encourage coughing and deep breathing to clear mucus and prevent lung collapse. We must also administer medications as prescribed and monitor for side effects, maintain hydration and rest for healing, and also provide health teaching such as finishing the full course of antibiotics and avoiding smoking to prevent relapse. Lastly, promoting infection control through proper hand hygiene and mask use when coughing. So, in conclusion, pneumonia is an infection that causes inflammation and fluid buildup in the lungs, which leads to difficulty breathing and low oxygen levels. Early diagnosis, prompt treatment, and consistent nursing care are key to preventing complications like hypoxemia and sepsis. And with timely detection and proper management, most patients recover fully. So, before I end, there's something I want you to reflect on. Why is it important for patients to complete their full antibiotic course even when they start feeling better? So that is all for my presentation on pneumonia. Thank you for listening.